Look to your left, now look to your right. Statistically, one of you will experience a UTI in your lifetime. For many, it won't be a one-time event. But suffering in silence and hoping it will go away is why this incredibly common infection keeps coming back for millions. A urinary tract infection, UTI, is often brushed off as a minor, albeit painful, inconvenience. The common advice is to drink some cranberry juice and it will pass. This dangerous underestimation ignores the significant pain, health risks, and recurring nature of what is a serious bacterial infection. Understanding UTIs is the first step to defeating them. What exactly is a UTI? A UTI is an infection in any part of your urinary system: kidneys, ureters, bladder, and urethra. Most infections involve the lower urinary tract, the bladder and urethra. The burning sensation is your body's inflammatory response to bacteria, most commonly E. coli, invading a space that should be sterile. Imagine your urinary tract as a series of pipes carrying important fluids. When bacteria enter the wrong pipe, they set up camp and start multiplying. This triggers your immune system to release chemicals to fight the invaders, causing inflammation. As the battle rages, the collateral damage affects you as pain, discomfort, and a whole lot of urgency to find a restroom. Recognizing the enemy, key symptoms: don't ignore these warning signs. A strong, persistent urge to urinate. You might feel like you have to go even when your bladder isn't full. A burning sensation during urination. The moment that urine starts flowing, the pain begins and continues after you finish urinating. Passing frequent, small amounts of urine. Cloudy, dark, bloody, or strange-smelling urine. These are all signs that things aren't right. Healthy urine is clear and doesn't have an odor. Pelvic pain, especially in women. This could be a sign that the infection has spread to the upper urinary tract or kidneys. Feeling tired, shaky, and running a fever. This indicates the infection might have reached your kidneys, which is a more serious complication called a kidney infection. Why do UTIs happen? UTIs happen when bacteria, usually from the gut, hitchhike their way into the urinary tract through the urethra and begin to multiply. Several factors increase your risk. Female anatomy. Females have a shorter urethra, about 4 centimeters long, which is the pipe that carries urine from the bladder to outside the body. So bacteria have a shorter distance to travel to the bladder. Sexual activity. During intercourse, bacteria from the vagina or rectum can enter the urethra and cause an infection. Holding it in. When you hold urine in your bladder for too long, you're giving bacteria more time to multiply and the higher chance of infection, not flushing out your system regularly. Certain types of birth control, like diaphragms or spermicidal agents. Spermicidal jelly contains spermicidal chemicals, which can increase your risk of getting a UTI. Your action plan, treatment, and relief: see a doctor. This is the most critical step. UTIs typically require antibiotics to kill the bacteria. While symptoms may improve after a day or two of medication, you must complete the entire course of antibiotics to prevent a recurrence or a stronger, antibiotic-resistant infection. Hydrate relentlessly. Drink water like it's your job. Fluids help dilute your urine and, more importantly, flush the bacteria out of your urinary tract. Staying well hydrated also helps to prevent future UTIs. Aim for 8 to 10 glasses a day. Embrace unsweetened cranberry. While the evidence is mixed, some studies suggest cranberry juice or supplements may prevent bacteria from adhering to the walls of the urinary tract, making it harder for bacteria to establish an infection. If you use juice, ensure it's pure cranberry, not a sugar-loaded cocktail. Use a heating pad. A warm pad applied to your lower abdomen can help soothe the discomfort and bladder. Pressure caused by a UTI, pain relievers like acetaminophen or ibuprofen can also help. But remember, don't take more than the recommended dose. Fighting back. How to prevent the next one. Prevention is always better than cure. Wipe front to back. Always wipe from front to back to prevent bacteria from the anal region from spreading to the urethra. Urinate after intercourse. After sexual activity, make a habit of urinating to help flush out any bacteria that may have entered the urinary tract. Don't hold it. Go to the bathroom as soon as you feel the urge. Holding urine can allow bacteria to multiply in the urinary tract. Avoid irritants. Skip potentially irritating feminine products like douches, powders, and sprays, as these can disrupt the natural balance of the vaginal flora and increase the risk of UTIs. Consider your birth control. If you get frequent UTIs, talk to your doctor about alternatives to spermicides or diaphragms. Red flags. When to seek immediate care. A UTI that travels to the kidneys becomes a serious medical emergency. Go to a doctor or emergency room immediately if you experience high fever with shaking and chills. Shaking chills indicate a high fever. Nausea or vomiting. Severe pain in your back or side, below your ribs. As we wrap up our conversation about UTIs, I want to emphasize that experiencing this condition is not your fault. You're not doing anything wrong. UTIs are incredibly common and can affect anyone. However, they shouldn't be taken lightly. The discomfort, potential complications, and recurring nature of UTIs call for attention and care. By educating ourselves about UTIs, recognizing the signs, seeking timely medical help, and taking preventive measures, we can all play a part in reducing the incidence and impact of this infection. Remember, knowledge is power. And when it comes to our health, we have the right and the responsibility to be informed and proactive. So let's continue to learn, share, and advocate for better understanding and treatment of UTIs. Together, we can make a difference. And if you found this information helpful, please like and share it with those who might benefit from it. Your support means everything to us. Thank you for watching. Until next time, stay healthy and take care.